All right, let's talk about a fluid that's basically a celebrity in the hospital world. Ringer's lactate. You see it everywhere, you hear about it all the time, but here's the thing. For something so common, it's probably one of the most misunderstood solutions in all of medicine. So let me ask you this. What if I told you that the key ingredient, the thing that gives Ringer's lactates its name, lactate, is the source of some huge misconceptions, even for the people using it every day? Well, that's exactly what we're going to get into. Okay, so to really get why Ringer's is so special, we've got to take one step back. We need to understand how any IV fluid really works with our bodies, and it all boils down to this one crucial idea: tonicity.
Tonicity sounds complicated, but it's really just about where water wants to go. Does it want to rush into ourselves? Does it want to get pulled out? Or does it just stay put? Getting that right is pretty much the most important job of an IV fluid.
So you've basically got three flavors, and Ringer's lactate fits right into that first one. It's isotonic. That just means it has about the same concentration as what's already inside our cells. So when you give it, it rehydrates the body without making the cells swell up or shrink. It's kind of the just right fluid for a whole lot of situations. Okay, now for the main event, the lactate itself. Seriously, the name alone makes a lot of people nervous. It's where all the rumors and confusion start. So let's clear the air on this once and for all. For the longest time, everyone thought lactate was just junk. Metabolic garbage your muscles make when you work out too hard. The thing that supposedly causes cramps. But nope, that's not the real story. It's actually an incredibly smart backup system for our cells. So here's the deal. When your cells are starving for oxygen, their normal assembly line for making energy just gets jammed up. To stop everything from grinding to a halt, the body pulls a clever move. It turns pyruvate into lactate. And this is genius because it frees up key molecules to keep some energy production going, and it even sponges up extra acid. It's not waste at all. It's a lifeline. So think about this. When we give a patient Ringer's lactate, we're doing two amazing things at the same time. One, we're boosting their blood volume, which is totally critical. But two, we're also handing their stressed out cells this perfect, ready-to-use fuel source. It is so much more than just a bag of salty water. Right. So now that we know what lactate really does, let's go bust some of the biggest myths that are still floating around out there. These are the misconceptions that can actually stop clinicians from choosing what might be the best fluid for their patient. Okay, this is a huge one. The logic seems solid, right? The fluid has some potassium in it, and the patient's potassium is already too high. So common sense says don't add more. But when you actually look at the math, the story completely changes. The truth is, there's a tiny amount of potassium in that bag, about 4 milliequivalents per liter, and our body is just massive in comparison. It's like adding a single drop of water to a giant bucket. The impact on the patient's overall potassium level is almost nothing. It's practically a rounding error. Now, this one is probably the biggest myth of them all. Your patient is suffering from something called lactic acidosis, meaning their blood is acidic because of too much lactate. So giving them a fluid with lactate in the name, well, it sounds like throwing gasoline on a fire, doesn't it? But this is where the name is so misleading. And this is where it gets really clever. The body grabs that lactate from the IV bag and uses it for energy. And that chemical reaction actually consumes acid, helping to fix the problem. The crazy part is that the other go-to fluid, normal saline, can actually cause a different kind of acidosis because of all the chloride in it. So a lot of the time, Ringer's is the solution, not the problem. So let's get even more specific and talk about sepsis. This is a life or death situation, and a high lactate level in the blood is a major warning sign. So you can imagine the fear of using Ringer's here is through the roof. But here's the critical distinction. The bag has sodium lactate, which is a fuel. It does not have lactic acid. When a patient with sepsis has high lactate, that's a symptom. It's a distress signal from their cells that they are struggling. Giving them Ringer's doesn't make the sepsis worse, it just gives those struggling cells a bit of energy to work with. Okay, so that's the science. But how does this all translate into real-world decisions at the bedside? Because knowing the theory is great, but applying it is what really matters. This pretty much sums it up. If acidosis is on your mind, Ringer's is often your friend. But on the other hand, if a patient's liver is really struggling and can't process that lactate, or if their potassium or calcium levels are way too high, then normal saline is probably the safer bet. It's all about picking the right tool for that specific job. But listen, choosing the right bag to hang is only step one. The single most important part of giving any fluid is watching the patient like a hawk, because even the perfect fluid can cause big problems if you give too much of it.
Take a look at this number, 250. 250 milliliters. What on earth could that mean? Well, it's the hidden secret to where all that fluid we're giving actually ends up.
It comes down to something called the 3-to-1 rule. For every full liter of Ringers you push in, only about a quarter of it, that 250 milliliters, actually stays in the blood vessels doing the job of raising blood pressure. The other 3/4, it leaks out into the surrounding tissues. And if you're not careful, that's what leads to all that puffiness and swelling we call edema. And you've got to be extra, extra careful with certain folks. Anyone with a weak heart, kidneys that aren't working well, or serious liver disease, they just can't handle big fluid volumes. They are at super high risk for fluid overload, so they need incredibly close monitoring. And finally, just a few non-negotiable safety rules. Because Ringers has calcium, you can never, ever run it in the same IV line as blood products. We already talked about being careful with liver patients, and you generally want to avoid it if there's swelling in the brain, because in that case, you need a totally different kind of fluid to help pull water out. So that brings us all the way back to our first question. When you really peel back the layers and get past the myths, you find this incredibly smart, well-balanced fluid that does more than just fill the tank. It actually fuels the engine. Now, is it the right choice for every single person every single time? Of course not. But could Ringer's Lactate be the true unsung hero of resuscitation? I think that's a pretty fair question. Thanks for tuning in.